Welcome to Healthy Frontiers. My name is Dr. Bizzoni. I'm a chiropractor. This show is dedicated to the education of our viewers. The topic for tonight is depression and anxiety in teenagers. And my special guest is Joy Spiegel. Joy is a licensed clinical social worker with over 20 years of experience practicing as a psychotherapist. She specializes in the use of cognitive behavioral therapy in the treatment of anxiety and depression in adolescents and adults. Mrs. Spiegel incorporates her formal training with life experience to help her patients cope with major life issues. She's here today to specifically speak about depression and anxiety in the adolescent population, and with an emphasis on cyberbullying and the challenges that teenagers face in today's times. So I'd like to welcome Joy to the show.
Thank you very much for having me.
My pleasure, Joy. So let's get started, okay? I'm going to ask you about depression and anxiety. So why is it necessary to talk about depression and anxiety in teenagers?
Well, as parents, we always are concerned for our children.
Sure.
But in treating teenagers, the adolescent period, I find, is the most challenging part of parenting.
Yep.
And specifically, my definition of teenagers in working with teens and younger would be 12 to 17. Now that's middle school age.
You are?
The Z generation, as today's teens are called.
Right.
But at 12, they really start struggling with issues that are related to adolescence, and we'll get into that in a little bit.
Sure.
But in treating adults, and the reason why understanding anxiety and depression in teens is so important, in treating adults, usually on evaluation, their first memory of having a bout of depression and anxiety traces back to their adolescence. So
Right.
I find it very interesting.
To go back when age 12,
So
etc.
in working with adults, it became much more obvious to me that the etiology of their illness, and I know it's interesting to call it an illness, but clinical anxiety and depression
Sure.
is categorized in the DSM-5 now as an illness.
Perfect.
That, you know, it does oftentimes, they'll jog their memory and say, you know, this happened to me back in middle school. They can write all as far back as middle school, mostly middle school. I don't usually hear of childhood depression and anxiety when adults come in.
Got it.
But that's why I've taken such an interest in identifying and diagnosing depression and anxiety in the teen years.
Perfect. Perfect. So what are some of the real issues and challenges particular to this age?
Well, from the physical developmental perspective, their rapidly changing bodies and hormonal fluctuations
Yes.
make them more susceptible to experiencing anxiety and depression. And why is that? Well, we can recall as teens acne, the embarrassment over acne, the start of menses can be very scary for some young ladies. So there's a lot of things that can attribute to being susceptible at that age, and hormones in boys as well as girls.
Right, right.
The mood swings primarily with the hormonal fluctuations. And again, that adolescent period starts, that puberty starts in, I would say, middle school.
Got it. Got it. So what makes teen issues more challenging in today's generation?
Well, I want to just back up before we go on.
Go ahead.
So we talked about the physical
Yeah.
changes, the
Sure.
physical developmental changes, but there's also social
There you go.
developmental issues taking place during that age.
Like?
Sexual orientation and self-identity. And what that means is really, what is my place in society? And confusion around sexual identity. During adolescence, social acceptance is critical. So imagine a boy or a girl recognizing, am I really, you know, what's my sexual orientation? You know, there's so much out there today about transgender.
Yep.
It's much more acceptable,
Yeah.
but at the same time, it creates a lot of potential anxiety.
Sure.
And if they're not socially accepted, then that could lead to depression as well.
Great, great. I'm glad you touched on that. So,
Right.
so what does make teen issues more challenging in today's generation?
Well, as compared to when we were teens, we can
Yes.
all remember feeling funny about, our growth and fitting in, and different physical changes. However, technology today is so advanced as compared to, we didn't have cell phones,
Right.
we didn't have social media.
Right. So those are the main pieces there. Cell
Right.
phones, social media, whole different game today.
Right.
Okay.
Right.
So I can assume teens compare themselves to others, as well as on social media.
Right.
What are your thoughts about this?
Well, social media presents a highlight reel of perfect moments.
Right.
And as adults, we can handle it. We know that that's not real.
Right.
But there's a pseudo-reality attached to this highlight reel,
Yes.
which can be very confusing for teens and make them susceptible. But I want to go back to your earlier question about social media.
Please.
And what it does for teenagers.
Please.
Because now, at the click of a button, when we were teens, we didn't know whether or not we were invited to a party.
Right.
Today, you can just open up Instagram, Snapchat,
Right.
and see Facebook. Teens don't use Facebook as much,
Right.
but you can see what's happening without you. And for many teenagers, it's isolating. It can make them more susceptible to anxiety and depression because of feelings of loneliness.
Right.
And again, I mentioned the social developmental perspective, that social acceptance is key at this age.
Sure.
So just imagine a kid sitting at home and seeing their best friend at a party without them.
Right. Right.
So we didn't have those challenges when
Right.
we were teenagers. Our friends went out, and unless they told us, we didn't know about it.
For sure.
So it's too much information.
Too much.
Not to say too much information even about what their friends are doing,
Yeah.
but life in general.
Yeah.
Technology, it just exposes them to just so much.
Right.
And they can't handle it. They think they can handle it.
Yeah.
But ultimately, they can't handle it. So, to summarize in terms of social media and what that alone is doing to our kids, it's really creating feelings of isolation, insecurity. If they're not accepted or invited or included,
Right.
then they interpret that as there must be something wrong with me.
Yeah, I get it. That makes so much
But
sense.
you mentioned something else about social media and popularity.
Yes.
And with popularity, again, that's a popular word in teenhood. With social media, you can gauge your likes.
Right.
So if you get 50 likes and your friend gets 150 likes, then these teens interpret that as, I'm not as popular.
Really.
So as teens, we didn't have those popularity polls.
Right.
We couldn't measure our popularity
Sure.
based on what parties we weren't invited to.
Yeah.
Or how many likes we got on social media. So technology is the main difference today
Right.
in terms of what our teen issues looked like
Yeah.
as compared to
Yeah.
the Z generation.
Makes so much sense.
Right.
So bullying is another teenage concern. All right, we're going to
Right.
talk some about this, I know. But can you talk specifically about how technology has impacted on bullying?
Yes. So, parents, you hear the word bullying and you cringe.
Yeah.
Parents are always worried about bullying. We've always been concerned about bullying. But now with technology, there is something called cyberbullying.
Okay.
Cyberbullying exposes these teenagers to online bullying. And basically, when we were teens, bullying started primarily on the bus or on the way to school.
Yep.
You hear stories about kids that, the books were knocked out of their hands and the
Yeah.
glasses went flying. I mean, you can just envision it. It's palpable.
Sure.
But today, bullying doesn't just begin on the bus, in school, and on the way home.
Right.
Now it's 24 hours a day. There is no respite from the bullying.
Right.
Online bullying, in fact, I'm going to quote something that I read. On CBS News. They featured an article last August linking this possibility on smartphones.
Okay.
The possibility being suicide.
Okay.
Okay?
Yep.
And they presented several cases where teens took their own lives due to cyberbullying. the article mentions how harassment through texts, Snapchat, and Instagram actually caused this young lady, and I can't quote her name due to privacy, to take her own life. So cyberbullying has created a 30 to 40% increase in suicide.
That's huge.
It's huge. And children have reported, teens have reported, that they're twice as likely to self-harm due to cyberbullying.
Wow.
In addition, the article said that the same young girl was excluded in school. So exclusion is huge. Again, I mentioned that earlier.
Yes.
Exclusion through the social media posts.
Yes.
And this girl was told in school at the lunch table, you can't sit here. You're not allowed to sit here.
Wow.
So technology definitely has created a major use of smartphones.
So we're talking about it, but how is this more detrimental than old school bullying? You know?
Well, because of the risk of suicide.
Okay.
And it creates a feeling of hopelessness in these children. The depression runs very deep because it doesn't end. Like I said before, it doesn't end. Years ago, you got home and you're like, okay, I'm home now, I'm safe.
Yeah, okay. Makes sense.
The other thing is that it becomes difficult to figure it out. The person being bullied is typically a friend, and this is the tricky part, is typically a friend of the bully, the person being bullied. So therefore, it's sort of like a crazy-making scenario because there's no one else to say, look, that person punched me. Or there was just an issue now in a local high school that I found out about. First day of school, the girl was assaulted in one of the local high schools, but it was visible to everyone else.
Yes, got it, got it.
So the social media and the smartphone, the harassment through text, social media, that's a different kind of bullying. Social exclusion is very insidious. You can't prove it.
Yeah,
you feel it, you feel excluded, but you can't prove it.
Yeah.
But this is an issue because it's really more anonymous as well. So even if a friend is bullying you, the child is less likely to go to a parent and say, Mom or Dad, I'm being bullied on first of all, they shouldn't be on their phones late at night, so they're afraid of getting in trouble.
Sure.
Right?
Yep.
Second of all, the bully typically will threaten the victim. And because you can anonymously harass another person through hijacking their identity, you can pose as them and send texts out and messages out, photos out. God forbid, you've heard of girls showing themselves inappropriately, and that gets sent all over the place. You can't take that back.
Right. Yeah.
So that's why it's more detrimental. That's why bullying today is more detrimental, because it is leading to suicides.
Sure.
The percentages
and
have
it's constantly
increased.
there. I mean, with the social media, as you're saying. Yeah, I mean, it's a constant repetition.
Not
it's
just
not
social media, it's texting.
Texting, yeah.
And so these kids are afraid to tell their parents. So it's very hard to know as a parent what's going on.
So what are some of the examples of online bullying?
Well, as I said before, harassment through texts, social media posts that are deliberate.
Right.
On Instagram, they're there, you can see them, but on Snapchat, a kid could just snap out that they're at a party and it disappears.
Wow.
So you can't even prove what's being done.
Right. And I have to say, I think a lot of parents are not even aware of all this. I mean, they may be somewhat aware, but a lot of older generation don't even know how to use Snapchat.
Right.
Never mind being aware of what's going on.
Right. Well, you have to, it's crucial to stay relevant to technology. I mean, my daughter's, a teen herself, and there's ever-changing things happening with these, different mediums that I can't even always know what's going on.
Even if we think we know some Facebook.
You always want your child's passcode, too.
Yeah. Oh, that's
It's important to be able to get into those phones at night.
Yep.
And that should be a deal
How easy is that to get from a kid?
Not very easy. Not very easy.
Right?
But,
sure.
You want the phone? I need the pass. And this is really important for parents to know this.
Okay, that's key. Yeah.
That they need, if your child's going to put a passcode on their phone, you need to make a deal with them.
Yeah.
That they need to be able to get into that phone. And I recommend you do that at least 3 times a week. But again, with Snapchat, it disappears.
It's gone.
Right, right.
Okay. So let's go on to some signs that a teen is suffering from depression and anxiety. What are some of the signs that you as a parent would recognize?
Well, I tell my parents of the teens that I see to pay very close attention to any changes in their regular routines. If they start withdrawing, staying in their room.
Yep.
The first thing that parents notice is drop in grades for those parents that
That's
are
the first thing
engaged.
they should.
That's usually the first thing that parents notice.
Right.
But what I recommend is to always be on top of subtle changes. Are they withdrawing? Like I said, drops in grades.
Right.
Sleep changes. Are they going to bed later? Waking up earlier? Changes in diet.
Right.
You know, any changes in weight loss, if you
Yeah.
start noticing radical changes in eating habits.
Yeah.
One area that teens often hide very well is cutting, you know, signs of self-harm.
Yes.
If years ago, I want to say within the last 10 years, cutting was very, very big. I'm not saying that girls, and it's typically girls, but I don't want to exclude boys.
Got it.
But cutting can be a sign of depression and anxiety. And typically, you can look on inside the arm for some marks.
Scars. And, yeah.
But the really crafty ones will cut in places where generally we as parents aren't privy to seeing.
Got it. Yeah.
Okay.
I never understood that, to be honest, the cutting.
The cutting.
It's so
There's different theories as to why these teens cut. The teens that I see that cut will tell me it's easier to feel, and it makes sense if you think about it, to feel the physical pain than it is to deal with the emotional pain. So they inflict self-harm so that they can focus on that. It's a maladaptive coping mechanism for depression and anxiety.
Right.
I also think it was a trend, but that's my own personal opinion on
Got
it.
it.
Other
Okay.
parents may disagree.
Yes.
But things, I mean, when we were teens, we never heard of cutting.
No.
I mean, I never heard of cutting.
No. No. Did
You
I?
know, we had other coping mechanisms that were not
Right.
kosher, but
Right.
cutting wasn't one of them.
Got it. Good. Okay. So we're so busy as parents. How do we stay on top of these changes?
Well, first of all, we need to put down our own cell phones, and we need to be engaged.
Yep.
It's very, very hard with the busy schedules of both parents and teens today.
Yep.
But you have to be relevant to technology and really make the time. Even if you carve out, you have to get creative about it. You know, parents will come in and say, well, I just don't have the time. When am I going to find time to sit down? And when you try to talk to a teen and schedule that time, it doesn't work.
Right.
But you have to build in a normal routine where you can spend quality, I suggest dinner, 3 times a week.
Right.
With
And we're all
old
together.
school days where we would sit, I don't know about you, but I
Right.
was forced to sit with my family and have
We were talking
Sunday
about that,
dinners,
the
right?
Sunday afternoon dinners, right?
Right.
Macaroni
But
was big in my
you
house.
get a lot out of your teenager when they don't feel threatened. And that's when they'll open up and start telling you, hey, you know, Johnny was talking about me on the way home, or, you know, I wasn't invited to a party, or, you know, I saw something on social media. Usually, though, they'll ask you things that you can start to question. You know, they'll put the question on you.
Right.
You know, it's interesting. But being available and engaged
Right. That's key.
and relevant,
Yeah.
being hip to the changes that are happening
Right.
in their world. Their world is very different from when we were teens.
For
I
sure.
can't express that enough.
That's very important.
Right.
So can these signs also be a sign of drug or alcohol abuse that you're talking about?
Yes, but oftentimes teenagers will experiment. I don't care what teen comes through my door. I always tell them, when your parents leave the assessment,
Right.
now you can start telling me what's going on.
Right.
You know, and we go through the laundry list. And I don't even know all the drugs that are out there. Vaping is very big today, and it's in the middle schools as well.
Sure.
So parents need to go to all of the workshops on that. The schools do offer that.
Yep.
They can hide the way they're vaping. It's a big problem. However, most drug and alcohol problems at that age are self-medication. So there is an underlying depression and anxiety that, you know, they're trying to cover up and escape from through the drugs and alcohol. So we need to accept as parents that kids are going to experiment.
Got it.
And it's not always, you know, a definition of a bigger problem or, you know, a reason for a bigger problem, but it could be.
Right.
It could be.
To recognize it as soon as possible.
Right. Early diagnosis.
Which is the
Absolutely.
next question here.
Okay.
So once a parent is concerned
Right.
about their child, you know, what should the next step be?
Early diagnosis is key.
Right.
I mean, like I said in the beginning of this conversation, adults come in and can oftentimes trace back their first episode to adolescence. So as parents, early identification is crucial. And referring them to a professional is just the best way to do this, because we can't, as parents, oftentimes distinguish between normal teen angst and a deeper rooted problem.
Right. So that's really where once a diagnosis is established.
Right.
Then, you know, what the treatment options, what are they? I mean, obviously what you're saying. So
well, I mean, I'm a psychotherapist, so I'm going to say that one of the first treatment options would be psychotherapy. To get your teen talking.
Right.
You know, you want to find a therapist, by the way. The first therapist might not always be the right fit, but someone who your teen can feel comfortable enough opening up to.
Right.
You know, that would be the first. That would be the first thing.
Did you normally work with the doctors, the families, medical practitioners, in harmony? How does that work? I mean,
well, the referral system is interesting. Some parents will call up their insurance. There are many psychotherapists who work in-network and out-of-network.
Correct.
If you're looking for an in-network provider, then you would get that list of providers through your insurance company.
Right.
Otherwise, perhaps the pediatrician may recommend someone.
Right.
But you had asked, you know, what would be the modalities of treatment.
Sure.
And I said the first one would be psychotherapy.
Yes.
But it could also be medication. So a combination of psychotherapy and medication, depending on the severity. It always depends on the severity of what comes in.
Always goes back to the primary diagnosis.
Right. Right. I mean, a kid just may come in with some low self-worth, low self-esteem, might need a few sessions to talk that through.
Right.
But in other circumstances, the depression and the anxiety is quite severe, where they may need a combination of psychotherapy and medication.
At what point would you, Joy, have a child maybe consider being, you know, go to a facility to have ongoing care, you know, 24-hour care? I mean,
oh, okay.
You know what I'm...
Well, again, it depends on the severity, but typically speaking, when a child comes in for an evaluation, we do an evaluation. We determine at that meeting how severe the diagnosis is.
Yes.
And I would usually recommend once a week. If the child is not suicidal, I would recommend once a week therapy for a few months.
Right.
If the child comes in and says, you know, I have thoughts of killing myself, then we refer to inpatient care.
Got it.
Now, it's not just psychotherapy and medication. There are other treatment modalities because not every parent is willing to put their child on medicine.
Correct.
That's just, you know.
That's the way it is.
It's the way it is. So I refer to holistic practitioners in that event, in addition to psychotherapy.
Yes.
And those, you know, that could be anyone from an acupuncturist.
Right.
I enjoy yoga. I tell the teens to do yoga, meditation.
Right.
Exercise, chiropractic even, if that's something that they're interested in doing. So I really truly believe in a holistic approach to treating anxiety and depression. And there's something for everyone.
And you've been doing this how long?
22 years, I want to say.
22 years. So you know, I mean, so just off the top of your head, I mean, not for numbers, but I mean, going that route versus taking the medication, have you seen really nice results in a lot of patients?
Absolutely.
Yeah.
Yep.
Okay.
In fact, studies have shown that adults as well who are on medicine for depression, for example, there's like I don't want to misquote the percentage, but like somewhere between a 95 and 99% decreased relapse rate in those that exercise alone.
Yep.
I happen to love acupuncture. I tell a
Yep.
lot of my
Sure.
my teen patients to go for acupuncture specifically for anxiety.
Yes. Yep. 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 I totally agree. I love it.
Right.
So-
And parents tend to shy away from medicine in teens.
Okay.
Not well, not all parents. It's again, it all depends on the severity. If you have a suicidal teenager,
Right.
then you'll follow the protocol.
Right. Exactly. And that
Right.
would be the only thing to do.
Right.
So,
right.
in this last minute, Joy, why don't you just summarize what a parent should look for again? What just
Right.
in a bit of a summary for the audience out there.
Well, you know, today's teens are faced with a much more challenging time due to the advent of technology
Yes.
and social media and cyberbullying being a very big issue in today's times.
Yeah.
So parents just need to stay relevant and engaged with their
Right.
kids, and early diagnosis is key.
Perfect. Joy.
Thank you so much. Thank you for having me.
I want to thank Joy for being on our show tonight, and I look forward to seeing you on the next show. Thank you.